So this is a long video, so I must warn you, but there is a lot of reason for this video. And the reason I'm doing this video is because a lot is going on with this COVID-19. And so there's several different articles, and I'm just going to get into it. So this article I thought was really strange because it says the U.S. exported millions in masks and ventilators ahead of the COVID-19 crisis. And so apparently what we've been seeing on the news and what we've been seeing here is that a lot of hospitals are having a shortage of masks and they're having a shortage of ventilators. And so this comes as a surprise right here in some ways. So this is by Diane Zhang and Erin Mansfield, Diane Voles, and Pulver. So I don't know if I'm saying the names correctly, so sorry. I have to apologize if I misspell or mispronounce people's names, but this was a USA Today, and so this is really weird because a lot of the hospitals were saying that they needed more ventilators or they needed more masks or they didn't have enough protective gear to wear. So the U.S. exports of surgical masks, ventilators, and other personal protective gear to China skyrocketed. This was back in January and February. And so I'm just going to say this off at the top of from what I know is that back then in that time when they had asked for the masks and the ventilators, this might have been around the time that they knew that this virus was rampant in Wuhan, and a lot of information was withheld from the public or the general population, so a lot of people weren't aware of this. And so China had asked for the mask and the ventilators, and they got a lot of resources from the U.S. that had been exported because they said that the first cases started back as early as 2019 of November, and then the whistleblower in December, he tried to come out and speak. So several people actually tried to say things from those countries, but they were silenced from their government. And so we heard of Ah Fen, who back as early as November, she tried to speak out, and she all of a sudden that doctor vanished. Then you had another doctor, Lai, I believe his name was, and he's succumbed to the virus in February, early in that 2020. And so what's really scary here is that it seems as though a lot of information was withheld from the general population. So they knew how dangerous this virus was, and so they had received all of the necessary masks and ventilators that they needed to keep as many people alive as they could. So this was the money that they also received and what it was worth, because it was worth a lot of money, of course. And so it said China skyrocketed. It said the protective gear to China had skyrocketed as early as January and February of 2020. So when the coronavirus was wreaking havoc in the country where it began, and as the U.S. intelligence agencies warned it would soon spread, American companies sold more than 17.5 million worth of masks, more than 13.6 million in surgical garments, and more than 27.2 million in ventilators to China during the first 2 months of the year, far exceeding that of any other similar period in the past decade, according to the most recent foreign trade data available from the U.S. Census Bureau. So the USA Today analysis of the trade numbers comes as medical professionals on the front lines of the nationwide crisis say that they are being forced to use or go without personal protective equipment like surgical masks, face shields, and account for a shortage. And so some states also are scrambling to find ventilators to prepare for a crush of patients expected to need them. Okay, so, and I don't know why it says crush. I think it should have said rush. That's my personal opinion, but the White House and the Congressional Intelligence Committee were briefed on the scope of the threat of the coronavirus in January and February, but the President Donald Trump has not stopped exports of key medical equipment, a move taken by at least 54 other countries so far. And so the data shows how U.S. manufacturers stepped up production and cleared out inventory to supply protective medical equipment to China for weeks. And so even as the threat of the coronavirus became clear, the CDC reported that its first case in the U.S. was on January the 20th. And so within the next 2 weeks, the World Health Organization and the U.S. Department of Health and Humane Services had declared that the disease is a public health emergency. So more than 213,000 people have been infected and more than 5,600 have died in the U.S. as of Thursday, the CDC has now reported. So clearly there was a surge in demand going on in China, and fundamentally this was a free market decision, said Michael Connolly, a Duke University economist. What was in the U.S. was clearly going out, and specifically it was going to China. And so those were the much needed equipment and gear that the nurses and doctors are requesting right now that they're in great need of. And so the U.S. exported more than 1.7 million worth of surgical masks to China. This was in January alone, and more than double the previous January and February shipment surge to about 15.8 million, the data has showed. So Jesse Wang, a co-founder of Lug Easy, a company that provides shipping services to Chinese residents in the U.S., confirmed the surge of mass exports in February. And so his company exported 14,000 and 15,000 pounds to 15,000 pounds of masks from the U.S. to China in as early as 2020 alone, in the early parts of 2020. So at a retail price of roughly 50 cents a mask. And so, which is likely higher than what wholesale customers would have paid. That meant more than 31.6 million surgical masks were shipped to China during the second month of the year based on the trade data. And so you can see the gloving, the mask, all the surgical and all the equipment that the doctors and nurses are very in much need of right now as we speak. And so taken together, the numbers add up to well over 28.5 million masks. That mirrors of nearly 200 U.S. cities. And so that could have helped a lot of people here in the U.S., of course, told a trade organization that they need to combat the corona outbreak. This was in China. And so they had sent a lot of gear and equipment there. So ventilators, which are very much needed when people are in their critical stage too, saw a spike. The U.S. exported 11.4 million worth of the breathing machines to China in the first 2 months of the last year, compared with 27.2 million in the first 2 months of this year, just weeks before the states and the hospitals started begging the federal government to send them more of these ventilators. And so the price of the ventilators vary from about $20,000 to $50,000 depending on the model, meaning the U.S. sent anywhere from 540 to 1,360 of them to China in January and February alone. So the U.S. Department of State also donated 17.8 tons of medical equipment to China in February. The mass donation included masks, gowns, gauze, respirators, and other virtual or other vital, I said virtual, vital materials. And so these are the much needed materials. Let me read those again. Masks, gowns, gauze, respirators, and other vital materials, which we now are in need of here in the U.S., all over in other medical systems, the hospitals. And so the Census Bureau collects the data as a dollar value representing the product sales price. The total exports of these items could be greater because the census data does not capture small private shipments that family members may have sent to China or small packages that are exempt from certain filing requirements. And so the White House did not immediately respond to the request for the comment. So the domestic demand is soaring. So, healthcare professionals across the nation have said on social media and many platforms, um, speaking out in the news reports that they say they fear for their lives because they are being forced to and ration disposable protective equipment for the entire week, and private citizens are sewing masks themselves to donate to local hospitals as a makeshift solution so workers do not have to tie bandanas around their faces. And on Wednesday, the New Jersey man was the first emergency room doctor to die from the COVID-19 or the coronavirus as we know it since the outbreak. A nurse in Houston is also fighting the infection herself. Exports of other protective garments like surgical suits skyrocketed too, so the U.S. shipped more than $271,000 worth of such supplies to China. This was in January, so 9 times more than the previous January that the data showed. And in February, those shipments reached $13.4 million. So Jared Moskowitz, Florida Emergency Management Director, said that his team started placing orders for the respirators, masks, gowns, and other supplies and private vendors more than a month ago, but received only 10% of what it ordered as of Thursday. And so I'm now hearing from distributors that foreign governments are showing up with cash at these factories and bumping everybody else down the line who had orders pending. So Moskowitz told USA Today, referencing conversations with brokers who serve as supply chain middlemen, this is going to have to be looked at to figure out how we allow the U.S. company to make, or the maker of perhaps the most important pieces of personal protective equipment to feed the globe, but not their home country, Moskowitz said. So Moskowitz, it is not alone. The mayors of 192 cities across the country said in a survey released Friday that they do not have sufficient face masks and for their first responders and medical personnel. And 186 cities said that they have faced a shortage of other personal protective equipment as well. So you see right here, these are the things that are needed. So completed face masks are packaged for shipment at the Tom Bihn factory in Seattle in March. And so Tom Bihn is a travel bag company that shifted production to face masks because of the COVID-19 outbreak. And so the survey said that the cities need 28.5 million face masks, 24.4 million other types of personal protective equipment, and 139,000 ventilators. So the respondents did not include mayors of some of the nation's largest cities like New York and Chicago. And so on Wednesday, Trump said that the strategic national stockpile, a collection of vaccines and various medical supplies kept for emergency, is almost out of personal protective equipment. And so we're giving massive amounts of medical equipment and supplies to 50 states, Trump said on Wednesday. So we are also are holding back quite a bit, he said, referring to ventilators that are being saved to meet peak demand, or to meet the peak demands that come up. It's this wave that they've been talking about, because they say the virus goes in like a peak. It has a peak, and then there's 4 waves, and so we're supposed to be coming into the either third or fourth wave of the COVID-19. So I'm adding that in there. So we will fairly soon be at the point where we have far more than we can use, even after we stockpile for some future catastrophe, which we hope doesn't happen, Trump says. So we're going to be distributing the countries to the countries around the world, and we'll go to Italy, we'll go to France, and we'll go to Spain. And so Vice President Mike Pence said Wednesday that the U.S. has distributed across the country more than 11.6 million N95 masks, more than 8,100 ventilators around the nation, and millions of face shields, surgical masks, and gloves. So trade issues that they've had, as domestic firms kept exporting life-saving equipment elsewhere, and Trump administrative team kept putting barriers on similar imports. And so according to Chad Bow, a senior researcher at the Peterson Institute for International Economics, the government continued placing tariffs on Chinese imports of many medical productions or products into the U.S., even the coronavirus, as the coronavirus reached the shores. So the Trump administration announced on March 10th and March 12th that they would relax those tariffs. And so Boeing called the move an acknowledgement and that the administration's trade policies were endangering public health. And so by that time, they were relaxed, he said, and tariffs already had affected nearly 5 billion of U.S. imports of medical goods from China, about 26% of all the medical goods imported from all countries. So a week later, Trump issued an executive order invoking the Defense Production Act that gives the federal government the power to force companies to produce medical equipment and fulfill needs related to national defense before any other contracts. And so the language in the order also allows the administration to control distribution in civilian markets of personal protective equipment and ventilators. And so it is not clear what the president will do with the authority. So economists are now warning that the countries are using protectionist trade policies such as exports, bans, and tariffs in the effort to keep medical supplies in their countries, and that these could backfire for hospitals and health professionals who need these supplies. So the team at the University of St. Gallen in Switzerland said that March 23rd study that any tariffs on items will increase the prices that hospitals and health professionals pay for these products. So the team recommended that the government reassess the restrictions to meet the social change of COVID-19. Bowen generally supports free trade as the economic policy that he also said it will benefit the public's health response. So there is too much uncertainty, he said, about which parts of the world will be hit hard by this COVID-19 to cut off any areas of the world from production. So what the pandemic has revealed to the world is that nowhere is safe. So Bowen said, keeping an open mind, the international trade right now in a time of a pandemic gives you many more options about where you might be able to source this kind of material from. So this is out of USA Today. It's about the latest on the trade data. And so that was one article that I thought was really interesting, because it was talking about how they had exported a lot of these much needed equipment that the doctors and nurses are needing right now, and a lot of that went to China in the earlier part of the year before anybody knew that this virus was going to hit here as strong as it has. And so This is really disturbing. It says as many as 100,000 incarcerated people in our jails and prisons will die from coronavirus unless the U.S. acts now. And so this is really, really sad because I know a lot of people think that maybe some people are not as important as others, but the prisons and jail population has a situation that's very, very, very in dire need. And so here you see, right here, you see how everybody is bunched together. How can you do social distancing when you're bunched together? And so that's the cells and crowded situations. And so up here you see what's projected that 100,000 incarcerated people in our jails and prisons will, not might, will die from COVID-19 unless the U.S. acts now. And so this is out of the Business Insider. So Beto Matthews out of Associated Press, Professor David Mills is a senior lecturer at Stanford Law School, and Emily Galvin Almanza is a former public defender and executive director of Partners for Justice. So they write that unless the U.S. acts now, there's a high probability that as many as 100,000 people who pass through the jails and prisons will die of COVID-19. In Rikers Island, the infection rate is just under 2.8%, which nearly 10 times higher than the rate in New York State and 18 times higher than the rate in Italy. So Mills and Galvin Almanza say that if the leaders fail to act, they are sending a clear message that they are fine letting countless people die and fueling a greater outbreak across our country. So this is an opinion column, of course. So I want to mind you that this is strictly an opinion column, but it has a lot of basis on what we're going through at this point in time. So the thoughts expressed here are those of the author. And so in just a few short weeks, the COVID-19 pandemic has laid bare vulnerabilities which we share as a society. So we adopted drastic measures in attempts to prevent a tidal wave of sickness and death. But yet we act quickly to save our own lives, and we have shown little urgency toward changing the fate of people living inside America's prisons and jails. And by failing to act, we are essentially deciding that their death is an acceptable outcome and that their lives are not worth protecting. Unless we act now, there's a high probability that as many as 100,000 people who pass through jails and prisons will die from this virus. So by now, almost everyone is aware that the U.S. has among the highest rates of incarceration in the world, and that our jails and prisons are filled with poor people, mostly people of color, and many of us know that our prisons are being used to house people experiencing mental illness. So we will see 100,000 people probably end up dying of this virus, and so we have not yet come up with a humane response to this reality. And so this is what is the growing need. So the COVID is now becoming a threat that takes our systems in humanity to a new and even more horrific level. So we know that the virus spreads in confined groups with frightening speed and efficiency. So in prisons and environments that are cramped, huge numbers will die. And so I'm going to go on to read the rest of this because this is important. So it says we are transforming their sentence of incarceration into a sentence of death. So there is a solution, and it's one that is requiring a new way of thinking. So during normal times, decision makers in the criminal legal system would assume that the surest way to minimize risk to an individual or their potential risk to the community is to keep them in a cell. But in the new face of this COVID-19 virus, we must acknowledge that the risk of death inside prison and jail walls has become higher than the risk of releasing most people. So the process of attempting to divine a person's risk to the community, and I believe it should have said confine a person's or confine people from away are their risks to the community has always been a compelling illusion. And so even the most well-developed risk assessment tools rely on data culled from a system full of inherent bias, and so none have proved able to accurately anticipate future behavior. But while we never or will never truly be able to predict the course of humans with free will, we are able to very concretely to predict the course of the COVID-19 through America's prisons and jail cells. And so the frightening reality has led officials in jurisdictions around the country to begin releasing some people from jail, particularly those that are held pre-trial or low-level nonviolent offenses. So the officials behind these decisions seem to understand that social distancing is impossible in locked and cramped facilities. I'm adding that in there. And the unhygienic conditions and lack of healthcare resources put lives at risk, serious risk so far. However, the vast majority of people who have gotten out, the ones who many would agree should never have been incarcerated in the first place. And so their release is a positive step, but it isn't nearly enough. The numbers are too low, and in New York, for example, officials have only released a few hundred people from Rikers Island, where over 5,000 people are held in close quarters, forced to eat in groups of 4 and share one toilet with 28 other people. So if the changes remain this small scale, hundreds of thousands of people could be sickened and they could die in custody. So with the degree to which jails churn population, almost 5 million people passing through jails and prisons, the U.S. roughly 2,800 jails annually, the virus will spread even more rapidly between and among the incarcerated population and staffers, and therefore back into the broader community once again. So this is David Mills pictured here. And so to meaningfully reduce population density, protect the most vulnerable, and the decrease of the spread of COVID-19, we must immediately release the broader group of people, the elderly whose recidivism rate is remarkably low, and people within months of scheduled release, people whose charges are misdemeanors or nonviolent felonies, individuals whose health leaves them at particular risk of COVID-19 and whose crime, alleged or otherwise,